Do you feel like your bones are getting weaker? Do you often suffer from broken bones or fractures from minor falls or bumps? Have you been diagnosed with osteopenia or osteoporosis? If so, this video is for you. Osteoporosis is a major health concern, affecting over 200 million people worldwide. It can be a silent disease, often showing no symptoms until a fracture occurs. But there are ways to prevent, treat, and manage osteoporosis. In this video, we'll go over what osteoporosis is, who is at risk, how it's diagnosed, the latest scientific research on prevention and treatment options, and practical lifestyle tips to maintain strong, healthy bones. What is osteoporosis? Osteoporosis occurs when bones lose density and quality, becoming fragile and prone to fracture. It happens when our body removes more bone tissue than it replaces over time. In healthy bone, there is a continuous process of bone tissue being removed and replaced. But with osteoporosis, the body removes more tissue than it can replace. This results in less dense, weaker bones that break easily. Osteoporosis versus osteopenia. Osteopenia refers to bone density that is lower than normal but not low enough to be considered full osteoporosis. Many doctors consider osteopenia as pre-osteoporosis, as it can progress to osteoporosis if not managed properly. Who is at risk for osteoporosis? There are certain factors that can increase your risk of developing osteoporosis. Being female, women have lower peak bone density and lose bone more rapidly after menopause due to estrogen decline. Advanced age bone density decreases naturally as we age. Family history of osteoporosis. Poor nutrition, low calcium and vitamin D intake. Inactive lifestyle, lack of weight-bearing exercise. Low body weight under 127 pounds. Smoking and excessive alcohol intake. Research shows that Caucasian and Asian women are at highest risk, but osteoporosis can affect all races. Men also develop osteoporosis, especially after age 70. Symptoms of osteoporosis. Osteoporosis is often called a silent disease as there are no obvious symptoms in early stages. Some signs to look out for include fractures or broken bones from minor falls or bumps, sudden back pain caused by a fractured or collapsed vertebra, loss of height over time, stooped posture from vertebral fractures, bone pain or tenderness. If you experience any of these, see your doctor for evaluation, as fractures are a strong indicator of osteoporosis. How osteoporosis is diagnosed. The gold standard for diagnosing osteoporosis and assessing bone health is a DEXA scan. DEXA stands for Dual Energy X-ray Absorptiometry. This scan quickly and painlessly measures bone mineral density or BMD. Based on the BMD results, your doctor can diagnose normal bone density, low bone density or osteopenia, osteoporosis. The test can also estimate your risk of suffering a fracture so your doctor can determine if you need treatment. DEXA scans are recommended for women over 65 and people with risk factors. Latest research on prevention and treatment. The good news is osteoporosis is preventable and treatable with proper nutrition, exercise, and medication if needed. Here are some of the latest evidence-based recommendations. Get enough calcium between 1000 and 1200 mg daily through food sources and supplements. Dairy, leafy greens, tofu and fortified foods are excellent options. Vitamin D is crucial, 800–1000 U per day to support calcium absorption and bone remodeling. Safe sun exposure, fatty fish, supplements are good sources. Weight-bearing and resistance exercises, activities like walking, jogging, tennis and strength training help build strong bones. Medications, bisphosphonates like alendronate and intravenous options like denosumab can increase bone density and strength. Monitor health conditions, thyroid disorders, rheumatoid arthritis and diabetes can increase fracture risk. Avoid smoking and limit alcohol, they interfere with bone building. Fall prevention, remove tripping hazards, install grab bars in bathrooms, improve lighting and balance. The key is starting preventive measures early, well before significant bone loss occurs. But it's never too late to take action to maintain and improve your bone health. Nutrition tips for strong bones. Proper nutrition provides the building blocks for growing and maintaining healthy bones. Here are some tips. Eat a rainbow of fruits and vegetables. They provide bone-supporting nutrients like calcium, magnesium, potassium and vitamin K. Include beans often. They are an excellent source of protein without the saturated fat that meats contain. Protein is important for bone matrix formation. Choose whole grains like oats, brown rice and quinoa, which contain nutrients like B vitamins, zinc, iron and magnesium. Refined grains lack these. Eat calcium-rich foods at meals. Pair greens, yogurt, sardines with a source of vitamin C to maximize calcium absorption. Stay hydrated. Some research indicates optimal fluid intake may support bone health. Limit sodium intake. Excess sodium causes calcium loss. Following a balanced, bone-healthy diet from a young age helps set the stage for lifelong skeletal health. It's never too late to make positive changes. More tips. We've covered a lot of ground on the causes, risks, symptoms, diagnosis and prevention of osteoporosis. While osteoporosis leaves bones weak and fragile, there are many things within your control to build strong bones for life. Focus on getting sufficient calcium, vitamin D and exercise. Incorporate bone-healthy nutrition choices. And don't smoke or drink excessively. With proper lifestyle measures and medication if needed, you can manage osteoporosis and stay active and independent for years to come. Our bones support us throughout life, so it's important to take care of them. I hope you found this overview on osteoporosis informative. Thanks for watching.